COVID outbreaks hit over 100 Australian nursing homes over Christmas. As a result of the COVID outbreaks, hundreds of elderly residents in care facilities have been placed in lockdown, with only a limited number of visitors allowed in. 385 cases of the extremely infectious Omicron strain have been found in residents and staff at more than 100 Australian aged care facilities over Christmas. Despite high vaccination coverage and a lower number of severe cases among residents, there are 65 infrastructure in NSW that are managing outbreaks, with many of them refusing entry to visitors. A lot of people are calling for changes to visitor policies in order to protect the mental health of people who live in old age homes. This is the most active outbreak this year. Seniors should be allowed to see one caregiver, says Council on the Ageing CEO Ian Yates. COVID outbreaks in nursing homes were up to 105 on Christmas Eve, more than double the number reported the week before. 27 of the NSW aged care outbreaks have 2 or more cases, and 4 facilities are dealing with at least a dozen infections among both staff and residents. Residents at St Basil's Lakemba, in Sydney, and Uniting Lillian-Wells North Parramatta are dealing with more than 40 cases of Ebola. Since November, high-risk groups such as the elderly, residents of aged care facilities, Aboriginal and Torres Strait Islander adults, and health workers have been able to receive a third COVID vaccine as part of Australia's Phase 1 booster program. However, due to the widespread spread of the virus, tens of thousands of residents in nursing homes and assisted living facilities are still scheduled to receive booster shots. Federal Health Minister Greg Hunt stated that aged care facilities had sufficient time to coordinate booster shots for residents. For Omicron, the time frame for boosters will be reduced from 5 months to 4 in the new year, starting on January 4th. On or after January 31st, people will be able to receive booster shots. Australians who are due for their booster shot on January 4th are expected to number in the 7.5 million range. After a 3-month delay, this number will rise to 16 million at the end of this month. During the holidays, the number of COVID cases across the country kept going up. This caused a lot of people to get sick. As of Sunday, New South Wales had 6,394 new daily infections, Victoria had 1,608, Queensland had 714, South Australia had 774, the ACT had 71, and Tasmania had 44. NSW Premier Dominic Perrottet reassured residents that the state's health system would be able to handle the increase in infections and urged them to go ahead with their vacation plans. However, state officials want people in New South Wales to use rapid antigen tests instead of PCR tests unless they have been told to, are travelling outside of New South Wales, or are displaying symptoms. This will ease the strain on clinics. The Omicron outbreak in South Australia has prompted the state to enact new regulations. From 12 a.m., house gatherings will be limited to 10 people, and hospitality venues and gyms will face density restrictions. A rapid antigen test, rather than a PCR, will be required upon arrival for interstate travelers. Most states and territories require the use of masks to prevent the spread of the highly contagious variant during the holiday season.